I'm now in conversation with Professor Ron O'Donnell, who's talking to me from outside Boston, Massachusetts. And we're going to have a conversation about his work in medicine and healthcare and some of the developments that he's seen in the use of digital technologies in his practices. So I'm beginning by asking Ron just to introduce himself and say a little bit about his role and the work that he does currently. So, Ron,
Thank you,
what's your
David.
role and what do you do now?
David, I'm a psychologist and a clinical professor with Arizona State University in the College of Health Solutions. And I was recruited there 12 years ago to develop a new degree program called Doctor of Behavioral Health. And the focus is on integrated healthcare, meaning how do you bring together in practice medical, lifestyle, and behavioral health treatment and management in a team-based approach. So I dedicated my career to that. And as an educator, our program is very large. It's an online doctorate degree. It's an interdisciplinary degree. We have students who enroll with an existing master's degree. They might be nurses, social workers, physician assistants, occupational therapists. And we train them to become doctoral clinicians or managers. We have two tracks, a clinical track and a management track, to develop a new workforce to join the family doctor and be a behavioral expert to address medication adherence, lifestyle change, nutrition, physical activity, weight loss to help prevent or manage non-communicable diseases. And of course, to address the very common comorbid behavioral problems like anxiety, depression, and trauma. So my role is really teaching these students to become the future workforce. And obviously, I'm a long-time champion of health technologies, and I incorporate in all of my classes and encourage my students to incorporate use of health technology in their work. I also do
That's
research and consultation in Asia, China.
well,
Great.
that's fascinating, and it's right up my street because it is a passionate interest of mine. But I want to begin by just asking you about how you got into medicine in the first place. What was it that inspired you? Have you always been in the medical profession? How did it all start?
Well, as a clinical psychologist, I earned my doctorate in clinical psychology, and my first job after I graduated was in a typical psychiatric hospital setting. But I find myself interested early on in my career at not just delivering clinical services. I like seeing patients. I also like seeing how do programs get designed? How do you know if they're working or not? Take more of a management and oversight role. So I found my career moving into an emerging movement called managed healthcare in the United States. And I went to a new organization that their focus is on hiring clinicians and leaders. I was a director there to lead mental health clinics, but to help patients address both their mental health and their medical problems. So I went from a career as a more psychologist, psychotherapy practitioner to a manager addressing certainly psychotherapy and behavior change, but also beginning to address all of our patients seem to have many health problems emerging, overweight, insomnia, things that are behaviorally focused. And I spent my career about 10 years in these clinics as a director and clinician. Then I moved to working for the health plan industry in the United States. In the USA, the health plans, they have a clinical role they play. So they have many clinicians they hire, nurses, physicians, psychologists, who work from cubicles trying to engage patients remotely to improve their health. So they leverage their health data. And that's my career went from more psychology to psychology plus medicine. I was leading teams focused on diabetes management, hypertension management, behavior change. And I've stayed on that course throughout my career since then, working on both sides of the fence, balancing holistically the patient's medical needs and behavioral health needs.
I think that's a very important discipline and very relevant today because, as you're aware, we've seen a big rise in the mortality rates as a result of lifestyle behaviours. It's a real challenge. In the UK, for example, the head of the National Health Service has very often spoken about us heading towards a cliff edge with the challenge of obesity from young people, then the problems that they develop in later life. So what experience have you had with the use of digital technologies to influence lifestyle behaviors? How has that evolved, and how do you see it developing?
For me, I'll begin personally. I'm a user of digital health technologies for my own health and well-being. So that includes everything from managing my own nutrition and weight by having a Bluetooth weight scale and doing daily weights, to look at my app for my physical activity. I'm an avid exerciser, so I go out and do swimming, biking, running, and use my smartwatch and associated apps to track my activity, to set goals for myself. I have my watch set reminders to do things like practicing brief mindfulness throughout the day to help manage my stress in my very busy job. So I use technology. I use Bluetooth remote for my managing my blood pressure. I've had hypertension the past year and trying to manage that. You know how it is yourself, trying to manage health problems with aging. So I'm an active user. And that's really important. If you're going to promote health technology, I think you must be a user yourself, understand the benefits and limitations of health technology. Now, secondly, I certainly incorporate this into my coursework. Most United States clinicians, medical and behavioral, don't naturally begin using health apps with their patients. They don't use apps, wearables, remote monitoring devices. It's not second nature. They're used to the face-to-face model still. So in spite of the mountain of evidence showing these are effective technologies to enhance care, they're not widely used. So I see my role as a champion advocate to raise awareness of the importance of this, encourage my students and future professionals to incorporate these tools in their own clinical work. I also have research interest. I have a colleague at ASU that has a smartphone app he developed. We're working on getting grant supporting to enhance that. And of course, I do work consulting in China and Southeast Asia, where I'm trying to promote the same technologies there. Whereas, you know, David, the need is even more acute because you have a very limited pool of physicians and nurses doing mostly medication management face-to-face. You have no effort to address behavior change and lifestyle in most of these countries because there's so many patients and so few clinicians. So I think developing a new workforce to use technologies like smartphone apps to address lifestyle and behavioral problems is critical for solving the gap they experience in developing countries between high patient demand, increasing obesity, right, diabetes, hypertension, and a lack of behavioral interventions to help that population.
Well, I certainly go along with your being a practitioner to effectively take your own medicine. I am the same, and I've been using wearable technologies for 7 years. And one of the things that I've observed, and I'd be interested in your views on this, I started this 7 years ago, and I was using basically the same kind of practices as you've described, the quantified self, measuring my weight, my blood pressure, my body mass index, setting myself challenges, both in the amount of exercise that I do and my diet. And after I started 7 years ago, I lost 21 kilos in the space of 3 months. And it taught me a great deal. It taught me a great deal about the importance of diet in all of this, particularly with weight management and obesity. And so I was able to maintain that improvement, and it had many other beneficial effects like mental well-being, having a zest for life, keeping my blood pressure low. You know, I've seen all of the benefits of adopting the use of wearable technologies and gamification. But then about 6 years ago, I changed my life situation. I'd been living on my own for a couple of years, where it was quite easy to control what I did and when I did it, what I ate and when I exercised. And then I've been involved in a relationship over the last 5 years. And so I've been living with my partner for that time. And I've encountered the problem that I'm sure that a lot of people do, is that if you're living with somebody who enjoys eating, enjoys a glass of wine, enjoys the things that I enjoy, it suddenly becomes much more difficult to discipline yourself. And so I found that I put weight back on again, not to the extent that I was before I first started, but certainly I became obese again. And it's only fairly recently that I've started to go back to measuring everything again. I've got Bluetooth weigh scales. I'm using a Fitbit Versa to measure my exercise. I'm recording my diet. So I'm learning over again, and again I'm seeing the same kind of results. So although I wouldn't say that I had mental health issues that affected my behavior, certainly the lifestyle situation I was in was complicated matters. Have you found that in your own experience?
Well, yes, and I actually lecture about that to my students. People have or clinicians have the impression that behavior change is linear, that I'll do an intervention, I'll do an 8-week group on diabetes management, my patients will learn and benefit, and they'll be fine. When in fact, we know it takes at least a year for a patient to learn the basic self-management. They call it conditioned self-management, knowing what to do to monitor my health on a daily basis, and become proficient at that. That's not an easy thing to do. It's very difficult to change long-standing lifestyle behaviors, right? You know that, and I know that. So we need to have clinicians to be aware of how hard it is for patients to change, number one. And number two, it's not something you go through for 8, 12 weeks, even 12 months and you're done. It's a lifelong journey. So you have different things happen in your life developmentally over time, whether it's relationship changes in your case. In my case, I had to go through a bout of head and neck cancer in 2016 and recover from that, which was a huge challenge to all my nutrition, lifestyle, and mental health issues. I've had different times, different things diagnosed in my life, whether it's sleep apnea, things that aren't life-threatening, but you have to adjust your life to them. And last of all, with aging, unfortunately, as we age, metabolism slows, I must constantly adjust my nutrition intake and exercise, because if I don't, I will gain weight every year, right? So the last year and a half, I found myself suddenly gaining about 8 to 10 pounds, which is unusual for me. I usually had a very stable weight. So I had to spend about 4 months to reverse that trend, and I have, but it's very difficult. And it takes, I think, an awareness that life is an ongoing challenge for managing your health. It doesn't end. You're not done. As you age, it's going to get more and more challenging, requiring more effort.
Absolutely. Well, it's very reassuring to hear you say that, but it will inspire me to continue that journey. I'm still on a path to hope. I've lost about 11 kilos so far, and I'm determined to lose another 9 or 10 kilos to get myself back in shape again, and hopefully by the end of the year I will be back on track. But moving now to coronavirus and COVID-19, what difference has COVID-19, what has been the impact of COVID-19 on the development and the use of digital technologies? Clearly, you are delivering courses remotely now, so we've seen more of that. And in speaking to other clinicians, obviously telemedicine is also on the increase, where you can't have physical contact. So what's your experience of COVID-19 and the impact of technology in the USA?
Well, the greatest impact has been the transition from in-person psychotherapy and even medical sessions to online telehealth video sessions. That's been a massive change. And in my case, I'd maintain a small clinical practice as a psychologist in my community. I've been doing that already off and on, so it was not a big shift for me. But many clinicians used to face-to-face work. Going to video psychotherapy or medical visits is a huge challenge they had to rise to. And there's been mixed results. Some patients prefer in-person, don't want to do telehealth. Many clinicians are not comfortable using telehealth as a modality. But you've seen a shift and overall a positive shift in my mind where for many years the payers in the United States, the insurance companies, made it very difficult to get reimbursed for doing telehealth, except in cases where there is remote access problems like in uh, rural areas. That's now changing. You're seeing a shift where most prognosticators think that this movement to now pay for telehealth as a covered benefit by insurance companies in America will continue even after COVID-19 because of the benefits. So that's been the biggest shift, David. And you're still not seeing an embrace of going to the next step, which would be having clinicians use telehealth plus encouraging their patients to use smartphone apps, wearables, remote monitoring of their health. That's not really occurring widely, yet there's an opportunity here to add those components. I'll also add COVID-19 has raised awareness of the importance of lifestyle, behavior change, chronic illness management, and health technologies, because we know from research now, if you are infected with COVID-19 and you have hypertension, diabetes, obesity, you're at much greater risk for mortality from those comorbid conditions. So in fact, we have a mission as clinicians to help patients who currently have those conditions to better manage them, to lose weight, to reduce their diabetes, hypertension risk, reduce their BMI, or if they're currently healthy, to stay that way and not move into being more at risk for COVID-19 adverse outcomes. We should keep in mind these same things that are made more relevant by COVID-19 because of how severe this disease is and how easily it's spread. They also apply for things like the average flu every year. If we did some of the same things, we'd have many fewer deaths from flu seasonally from the elderly if people were better managing their health, improving their health, doing more safety precautions such as mask wearing in public, things like that. So it's an opportunity to raise awareness not just for COVID, but for infectious disease in general, and how to improve our ability to withstand seasonal infections or future pandemics.
Yes, although obviously the pandemic has had a massive global impact, not just on health, but also on economies, your economy, our economy, the whole world economy is suffering. And I think it's likely that there will be a mental health backlash as a result of COVID-19 that may place a large burden on health services that we're currently not prepared for. But maybe that's something we can touch on during the webinar. I just wanted, before we close,
I'd like to address that.
Sorry?
One more thing about that, David. We know now from the research that the impact of COVID-19 on behavioral health is tremendous. You've seen a recent publication that depression's more than doubled in the United States because of COVID-19. We know there's increased anxiety, loneliness, increased alcohol abuse because people are drinking more at home now. So it's a huge impact. And I agree. When I say post-COVID, I think in the best case, we're at least a year away from that reality, right? With the vaccine development, dissemination, global, all the complexities of doing that. We're going to be having at least a year, if not longer, of living with this condition and the fallout, as well as people being depressed because either they or their family are losing their jobs in COVID. This is a global crisis that has a huge impact. And you're exactly right. There's a need for behavioral health clinicians to rise to that challenge, trying to offer more services to more people. And that's, again, telehealth means efficiency. You can do more with less of your time. If I can see 10 people doing a group telehealth session rather than one individually, that's a huge plus for population health approaches.
Absolutely. Can I just ask you about virtual reality and virtual environments and mental health? I had a conversation with a guy in Spain last week, and he was recruited to this immersive technologies virtual reality company that was set up to use virtual reality to try and address mental health issues, things like fear of flying, anxiety, stress, etc. And their business model is based on the development of virtual reality applications, which people like yourself can use to help manage the health of their patients remotely. So in other words, you would be in one location, the patient could be experiences a virtual reality experience under your control, designed specifically to address a mental health issue, fear of flying, arachnophobia, all of these kind of things. And what he was explaining to me, which I must admit, it hadn't occurred to me at the time, is that when you're looking at new developments in technology like this, it's very difficult for the healthcare profession to often adopt these because they're so used to having clinical trials. So if a new drug is brought onto the market, there's an extensive clinical trial which validates that drug, but that drug doesn't change. So once it's been validated, once it's been approved for use, it can continue to be used as long as it's effective and validated. Whereas with things like virtual reality, you're getting new virtual reality headsets virtually every year. You've got almost an infinity of different kinds of virtual reality environment. So I would say it's virtually impossible to have the same kind of clinical validation, clinical trials that you would have with pharmaceuticals, for example. And so you have to use evidence-based research to try and assess how effective these things are. Have you had any experiences of using virtual reality applications in mental health?
I have not personally, but I'm familiar with the research on virtual reality applications in mental health, and there have been evidence-based studies showing that they are effective. So for example, I saw a recent demo of a virtual reality approach for schizophrenia diagnosed patients, where they really have great difficulty recognizing in their environment people's facial expression, the emotional cues that represents. So they're placing the patient in scenarios, going to the store to buy something, visiting, walking down the street, trying to have them recognize avatar faces and recognize the emotions, and not to personalize, not to have their paranoia activated, right? To use those kind of virtual reality environments to help them. We call it exposure. Go through exposure to things that are ordinarily anxiety-provoking to them, and have them learn how to cope virtually before they go out in the real world and try that. And there's, again, you can do randomized controlled trials and find these are beneficial in reducing patients' anxiety, depression, even impact of auditory hallucinations on their day-to-day functioning. The challenge, of course, is going to scale, because virtual reality is largely confined to the enthusiastic gamer group, where it's very, very great effect for them, and it's very immersive and engaging. We need to take that same leap. I think when we get better at reducing the cost of virtual reality headsets and the availability, and developing more immersive healthcare experience, whether it's medical or behavioral, the opportunity is fantastic. Like everything else, that will only improve as technology costs go down and the technology benefits increase. I can imagine walking into a virtual shopping grocery store and having myself make decisions about what to buy. Am I going to go ahead and buy all the cookies and candies and cakes, or am I going to look for fresh vegetables in a virtual environment? These are great ways to do things that are much more impactful than trying to have me describe to a person on a video session about the benefits of healthy shopping, right? So I think the opportunity is great, but we're very early in the application of this in healthcare.
Yeah, I think you're absolutely right. And I don't know whether you've heard of a solution called Alco VR. Have you heard of that before? Alco VR?
I have not, no.
Alco VR is interesting, I think, because it's a consumer product. It's not a product which is intended to be a healthcare product per se. But what it does is for users of off-the-shelf virtual reality headsets, it allows them freely to explore a virtual environment, which is basically an apartment with a very nice apartment with a couple of rooms and a balcony which overlooks. You can choose whether you want to overlook the sea or a forest, or a very pleasant environment. And in the apartment, there are a number of different activities which you can enjoy with your peers and your family. So if someone in your family is wearing a VR headset, wherever they are, you can watch a movie together. You can listen music together. You can go on a virtual tour of different places around the world together. You can have some experiences like flying in a hot air balloon together. And if you go out onto the balcony, one of the things that interested me was the fact that they have a little chair on the balcony and a coffee table. And on there is a book about personal health management. So if you just click on that book, it then takes you into a series of different exercises that you can use for mental health. These are developed by a third-party company, and they include exercises for stress management. They include exercises to develop your response time. So originally these applications were developed for people maybe with dementia or memory problems. So there's a series of games which are all healthy oriented. So without being a healthcare application per se, you can see how different ideas are coming together in the consumer space that hopefully will have some impact on mental health and behavior change. So I very much appreciate you joining me today to share your experiences with me. And I'm looking forward to seeing you again on Tuesday, where we'll be able to join with other experts with different kinds of disciplines and backgrounds and look at how digital healthcare in the USA is developing, what the future is, as part of a program where we can compare and contrast what's happening in different countries. So thanks once again, Ron. It's good to talk to you again.
Thank you, David. Look forward to talking to you next time. See you next week.